Namaste everyone, Dr. Amit here. Hope you all are doing great. Welcome back to my YouTube channel at the Dr. Amit Official, where we make medical concepts simple and practical. So if you haven't subscribed yet, don't forget to hit that subscribe button and stay updated with all our medical videos at the Dr. Amit Official. So in our last video, we covered from our biochemistry series an important gram-positive bacteria, that is Corynebacterium diphtheriae. Now today we are moving to another important gram-positive bacteria called Listeria monocytogenes, and this is a must-know topic for your MBBS exam, your any entrance exam, NMCL exam, USML exam. So I'll break it down in a simple, clear and exam-oriented way for you. So stay with me and let's get started with our today topic, Listeria monocytogenes. So our today topic is Listeria monocytogenes. Okay. So first let's discuss about a lab feature of Listeria monocytogenes. Okay. So we all know it's a gram-positive bacteria, a rod and facultative organism. Okay. So now talking about its special feature, it shows tumbling motility in broth. Okay. Sometime in MCQ they give system tumbling motility. Okay. So always think about Listeria monocytogenes. Okay. And this gram-positive organism, Listeria monocytogenes, it grow well at refrigerator temperatures. Okay, so this they also give this clue that bacteria grow well at refrigerator temperatures. Okay, so think about Listeria monocytogenes. Okay, now talking about the source of infections, from where we get Listeria monocytogenes. Okay, so it can be a foodborne. Okay, like if we take or if we ingest if ingestion of unpasteurized dairy product, okay, any dairy product, if it's unpasteurized, then there will be chance of getting Listeria monocytogenes. Okay, then remember this term, cold deli meats. They often use this term in the MCQs in the USMLE and in PG entrance exam, cold deli meats. Okay, now apart from foodborne, there is some other also source of infection like vaginal transmission during birth. Okay, from mother to baby. Okay, this bacteria can get transferred. Now talking about what are the effects if anyone get infection with Listeria monocytogenes, then how it affects to that person. So let's first talk about the effects on pregnant patient. Okay, so in pregnant patient it can cause spontaneous abortion. Okay, it can cause amnionitis. Okay, and it can cause septicemia. Okay, to pregnant ladies. Okay, now talking about neonates. Okay, the newborn baby. Okay, it can cause granulomatous infant septicemia or septica. Okay, then sepsis in neonates, and it also causes meningitis. Okay, in the brain. Now coming to immunocompromised or older people, it can cause meningitis. Okay, now it can be mild or self-limited, and it causes gastroenteritis in healthy individuals. Okay, so these are the effects of this Listeria monocytogenes on different patients. Okay, now talking about the pathogenesis. Okay, so we all know it's a intracellular survival. Okay, and we also call it as a facultative organism, that it can live in different conditions, like even in suppose we define simply bacteria as facultative, means if it can grow well in aerobic condition, also anaerobic conditions also. Okay, so can live in different conditions. Okay, so that's why it's called as facultative organism. Okay, so now talking about its pathogenesis part. Okay, so they are intracellular survival. Okay, so suppose Listeria monocytogenes enter the host cell, suppose it enter in our body. Okay, then with the help of listerolysine O, okay, generate pore in phagosome. Okay, so just think that phagosome is a gel. Okay, the bacteria is living in a gel, and this listerolysine is a drill machine. Okay, so this listerolysine make pores in the phagosome. Okay, so that the culprit, I mean this bacteria, can leave the gel and escape into the cytoplasm. Okay, so this listerolysine generally make pores in the phagosome and escapes in the cytoplasm, then form a rocket tail. Okay, always remember this term. Okay, this listerolysine and rocket tails are buzzword to understand Listeria monocytogenes in MCQs questions. Okay, then move from cell to cell. Okay, after coming in cytoplasm they can move cell to cell. Okay, now coming to diagnosis part of this Listeria monocytogenes. Okay, we can do blood culture or we can do CSF culture. Okay, so when we do the CSF culture, we will get lymphocyte predominance. Okay, like in viral disease. Okay, remember this. Like in viral, it causes lymphocyte predominance. Okay, now after diagnosing a patient, we'll come to a treatment part. So the drug of choice will be always ampicillin first. Okay, plus minus gentamicin. It's not necessary, but ampicillin is a drug of choice. Okay, now this is very important. Okay, so how to prevent this Listeria monocytogenes? Okay, so this Listeria monocytogenes is very important to prevent in pregnant patient because it causes spontaneous abortion, amnionitis, septicemia, and also in the neonates it causes what, granulomatous infant septica, sepsis, and meningitis. So that's why how to prevent. So we can prevent it by avoiding unpasteurized dairy products in pregnancy. Okay, so in pregnancy, that's why we always tell to a pregnant woman that don't take unpasteurized dairy milk or dairy products. Okay, because there will be a chance of infection from Listeria monocytogenes. Okay, so this is all about this gram positive facultative organism Listeria monocytogenes. I think this much is enough to solve all the MCQs for different competitive exams. Okay, so if you like this video, please do like, share, and subscribe my YouTube channel, and share with your fellow medicos, and share the links in your medical college groups with your friends. We'll meet in next video on a new topic from the MBBS subjects. Till then, work hard, keep studying. Thank you.